to Tech Talk with WSU Tech, where we dive into all things WSU Tech and highlight the voices within our college community. I'm Dr. Sheree Utash, and today we have the honor of chatting with Lynn Loveland. Thanks for being here, Lynn.
Oh, happy to be here, Sheree.
So we always like to kick things off with having you introduce yourself and tell everyone what you do and how you serve the mission of the college.
Well, my name is Lynn Loveland, and I am Dean of Health Sciences at WSU Tech. So the mission of the college is to provide affordable education for students so they can better their lives, help better their family lives, provide a pipeline for industry, and also to create economic prosperity for Wichita. And I think our healthcare areas do that in so many ways. So we're providing students educational opportunities to help better their lives, help better my life as a patient. And I just think it's such a valuable mission.
I absolutely agree. I think healthcare is, we have a lot of industries we serve within the college, but healthcare is such an incredible lift when I watch those students from where they come in to when they leave and they go into the workforce and they take their talent and their knowledge and their skills to make sure that all of us are healthy and being taken care of appropriately. So I agree with that. It's really great to have you here today. So healthcare is such a huge part of the college and the work that we do, and it has been for almost 60 years. But something kind of news happened over the last couple of years. So today we're going to talk a little bit about the future ready for healthcare. And I want you to talk about how it has become a significant addition to the landscape of our healthcare programs at WSU Tech.
Yes, we were excited to partner with Wichita Public Schools, Wesley Hospital, Blue Cross Blue Shield to provide educational opportunities for high school students. In the past, we had faculty who went out to the individual high schools to provide these courses, but that really wasn't an effective way to provide that education. So by building the FutureReady Center, the students come to us, our faculty can stay in one place. The students are in a college atmosphere, and I think that it helps them see the value of that education. And also they learn from our faculty who have had stellar careers in industry, and they teach them about professionalism, about what it takes to be successful in a healthcare job. And our faculty also show them the passion that they have for the profession. And I think those are just invaluable.
So the Future Ready Center is a whole new build out.
It is.
And tell me about the build out. Tell me about where it's located and how successful has it been so far?
Well, it's located at the Harry Street campus, and we did a complete remodel of an interior space. We spent a lot of time with our faculty learning what they needed to provide stellar education. And so we have the state-of-the-art labs for our CNA program, EKG and phlebotomy, and also our EMT program. So we are able to work with the school district to provide opportunities for students to come and learn.
So if I am a parent of a high school student, what do I need to know about this, and how can I get my student involved if they want to do healthcare?
Well, this has been extremely popular. I think this is our third year, and we had a waiting list of over 120 students. So students want to come to the healthcare FRC and get a profession. They need to know that it's a college course, and so parents need to make sure that their students are ready to really actively participate in their learning. Several of our programs have either shadow opportunities or they have clinical opportunities where the student will get to go into an industry and learn from those professionals who are working at that job. So they get to really get a taste of what it is to be a CNA, what it entails, the difficulties, and also the rewards of having a healthcare career.
So is there a particular age they have to be to go into this program?
We prefer to have juniors and seniors. many of our programs to test for their licensure have to be 18 years of age. So by the time they are in their senior year, most of them are turning 18 or have already turned 18, so they can go into the environment and shadow. And so that is why we don't really accept students younger, though they can take med terminology, A&P, biology, and get themselves ready to go into our college classes.
So like pre-health classes.
Pre-health classes, yes, that's
So talk about what do students get at the end of this? Do they get industry credentialing? Do they get certifications? Do they get a degree? Talk about that.
Yeah, it depends on the program. For CNA, they get a state certification because that program is regulated by KDADS, and so they do take a test at the end of the program, and if they pass the test, then they are certified to work as a CNA. EMT also is a state board certification, so they graduate from the EMT program and then will take the state board, which is a very difficult board to take. But you figure if you need an EMT, you want to make sure that they know
we want
what
them
they're
to know
doing.
what they're doing
Exactly.
when they come. Come in the ambulance to our home.
EKG and phlebotomy also have certifications. It's with a different accrediting agency, but they do get a credential. And also for patient care tech, which is the accumulation of many different smaller, shorter-term programs that overarch many healthcare arenas.
So they can finish that as high school students and be able to be work ready.
Absolutely.
And then continue to do that work while they that becomes their career, or they choose to continue their education, right?
Yes. And for so many of those jobs, the hours are flexible, so it lets them continue on to college if they want to and still earn a really good amount of money working a job. But it's also a great job if that is your end goal.
Sure.
And sometimes you need to work in an area a little bit and then maybe decide what your future steps will be. So this is a perfect stepping stone.
That's great. So you talked about hands-on. Tell us a little bit about what does a student get in hands-on application?
Well, I would say for phlebotomy, you actually get to stick people, so you can't get much more hands-on than
Do you
that.
look for volunteers?
We do. We do. First, we start with, of course, a dummy arm, which does have pseudo blood running through it, so they can practice on that. Then they practice on each other, and then we do put out a call around the college for individuals who might like to come in and help serve as patients for our students. And it's surprising the number of staff and faculty we have come in and help our students with their educational
That's applied learning
journey.
at its finest.
Absolutely.
Here's my arm.
Yeah, exactly. For CNA, they actually do the didactic work first, and then they have 20 hours of skills lab where they work with an instructor, and then they go to an actual long-term care facility, and they have 25 hours that they work with an actual CNA and nursing on the floor, actually helping treat patients. So you can't get, like I said, more applied learning than that.
So we hear a lot about workforce shortages in healthcare. How does the Future Ready Center help address workforce issues and the gap that we have of qualified people going into that talent pipeline?
Yeah, COVID certainly did a number on us as far as healthcare. It was a really rough, dark time for providers of healthcare. We've seen an uptick in that, and you hear that we have to get students interested in science careers earlier and earlier. So we have used the Future Ready Center just recently to bring some middle school students through.
How many did you have?
We had so many. It seemed like 200.
Yeah, that's what I heard, 200,
We had 200 middle school kids. And each profession had like some kind of a job or some kind of activity that gives them really hands-on experience. And We had a surgical technology display, and if you remember the old Operation
Yeah.
game, well, we had a box with some suckers in it, and they actually used robotic fingers to pick up the sucker. If they could pick up the sucker, then they got to keep it. So that was a really wildly popular
I'll bet. But
hands-on activity.
those robotic fingers are really hard.
They
I've
are
tried them. That's very hard to do.
because
I
everything's
would
kind
never
of
make
backwards.
it in surgery.
Yeah, that's difficult. We also had dummy arms, and they actually used a vein finder and did some phlebotomy.
So creating awareness of
Yes.
all the different things, because probably most young people know what a doctor and a nurse is, but they don't know about all these other things.
Right.
Correct?
Right.
Talk about your local partnerships, the clinicals, the partnerships that you have with the healthcare industry in this community, and why is that so important, and how do they contribute to the work that you're doing?
Well, we couldn't run our CNA program without long-term care facilities because they have to spend 25 hours actually working on a floor. So it's just crucial that we partner with them. And I think the long-term care facilities like it too because they get to sort of soft interview our students and see, if they mesh with the other nursing staff, if it's someone that they think would fit well in their organization. So we have a very symbiotic relationship with them. EMT, we have our students do ride-alongs with Wichita Fire, Eagle Med. They go to Wesley Hospital and shadow there. So industry is as anxious to get our students in their door as we are to get them in the door. So we are very reliant on each other.
So what are some of the most popular pathways that you have when you look at what's in the Future Ready Center? Like, where do students, really want to be, and how do they choose what they want to do?
I think with CNA is probably the one that has the longest waiting list. It's also one of the shorter programs, so it's a little bit quicker to get through. There are many opportunities for people to work in long-term care facilities because there are so many jobs available. And that is a profession where you really get to spend quality time with a resident. I mean, you can be the resident's best friend if you're a CNA, and they really are the lifeblood that keep those areas going. If you like adrenaline, then perhaps EMT would be the place for you because it's more of a short-term interaction with the patient, but certainly it's critical. It's very, very critical. We've had some shortages in that area, and so response times is a concern, and so we are wanting to get as many students in that as we can find.
And if I remember right, don't we have a EMT to paramedic program that we have available once they get through high school?
Yes.
And then
we
that
do.
works directly with Sedgwick County EMT?
Yes, it does. And we're also working on a step-down program that's not quite as intense as EMT.
Talk about that.
It's an emergency medical responder, and it is really geared toward like law enforcement and the outside rural areas because there are many times it's law enforcement that are the first individuals to a disaster, a critical situation, and they don't always have the necessary medical training to be the very first responder while they wait for an ambulance to come, fire truck to come. So we are training them to help deliver immediate first aid because they're on the scene first.
Which are critical moments.
Exactly. And, if out in the rural areas, there are many farm accidents, and sometimes it's 20, 30 minutes before you can get any kind of ambulance service there. So having volunteers that can go out and render some aid, like you said, is critical the first few minutes.
So looking to the future, what are your goals for expanding or enhancing the FRC to meet the ever-changing needs? Healthcare changes a lot. So what are you thinking?
Yeah, healthcare does change a lot. Sometimes regulations don't. So
True.
we always need
That's
help
true.
in the legislature to try to make sure that the rules and regulations are keeping up with the profession. We need faculty, and that has been a stumbling block along the way because during COVID and right afterwards, you could get such a large payment if you provided hands-on care. And education, though it's a passion of mine, a passion of yours, it doesn't really pay sometimes what you can make in private
Yeah,
industry.
especially in this particular industry that we're talking about.
Exactly. And it's not easy. I mean, healthcare is not easy to teach because there's so many innuendos that go into it, and it's difficult for faculty. So, and with short-term health, you have to have so many credentials and have spent time in a long-term care facility. So just because you're an RN, a BSN, you may not really be qualified per regulation to
Sure.
teach CNA. So those are the things that I stay up at night worrying about.
So we've talked a lot about the Future Ready Center. I want to pivot just a minute and give you a chance to talk about the other healthcare programs that you oversee, and also the upskill reskill that you're doing with some of our medical communities at WSU South.
Well, we have a surgical technology program, and I think most people know what that is from different hospital TV shows.
Looks just like one.
Yeah,
It
we
does.
do.
It looks just like it in the lab.
We have a 4-bed OR unit that has the lights and the tables, and we have the thousands of instruments that you have to memorize to be a surgical technologist. And I mean, if you are detail-oriented and prompt and like that kind of fast-paced environment, it is a great career. We have faculty that have worked in hospitals for many years, assisting physicians, and now bring that expertise to.
It's high demand too.
It is. It absolutely is. And there's a little physical element to it because you're standing for long hours. So people have to make sure that they are physically ready to be able to take on such a demanding career. But the hours are pretty good if you're an early riser, because most surgeries start early. But that is a very good profession. One of the ones that we get the most interest in is veterinary nursing. So we have a 2-year program where you can go through this program and be a registered veterinary technician. And we have a little joke among nursing and our vet nursing that vet nursing is more difficult because our patients never talk. And we have 120 species versus just the human body, which is just one. So, but it's great. People love their animals and are very passionate about their animals. And we have a lot of students that have that same passion. We are really needing students to go into large animal. So like for ranching, for cattle, goats, sheep. I mean, people like the little pocket, poodles.
Little dogs.
Yeah. But
Little dogs and cats.
Yeah, we have a need for all types.
So how can people in the community support what you're doing with healthcare and continue to support and grow and help you be successful?
Well, I think just making sure their students do well in school and that they understand the value of being prepared and studying and being serious about a career. I think that if you're in the medical profession, being a mentor, allowing a student to shadow you is so important. And then if you are a healthcare provider, think about going into education and helping us educate the next round.
Paying it forward, giving it back.
Exactly. And if you want to give a donation, we'd always be happy to accept
We absolutely would.
something to help staff our labs. I mean, there is a lot of cost that goes into training for healthcare. We have a lot of supplies, and so a lot of expensive equipment. And so it's always helpful to train students on technology that they'll be actually working with in a hospital or healthcare setting.
So I want to thank you and your faculty and all your program directors and everyone that works in healthcare for what you do and what you're doing for this community and how you're lifting people up to have economic prosperity and a career. And I also want to tell you that my mom and dad are in a long-term care facility in independent living, but we had a situation not too long ago where we had a CNA from WSU Tech that was taking care of them for some of their medical needs. And I got the opportunity to witness that firsthand. And they did a great job. And from the bottom of my heart, I thank you for what you're doing. Thank you for tuning in to Tech Talk with WSU Tech today. Be sure to subscribe so you never miss an episode. And until next time, stay connected and keep exploring the incredible work that's happening here at WSU Tech.